Hello friends, let us now learn some important points about human chorionic gonadotropin. So this human chorionic gonadotropin, it is mainly synthesized by syncytiotrophoblasts. It is synthesized by syncytiotrophoblasts. This is actually a major glycoprotein which is produced, and this, because it is a glycoprotein, it has maximum glycogen content. Okay, this HCG has two subunits. One, it has an alpha subunit. Okay, second, it has a beta subunit. Alpha subunit occurs is seen on chromosome 6, beta subunit on chromosome 9. Alpha subunit is similar to LH, FSH and TSH, whereas this beta subunit is specific. This beta subunit is the one which is measured in pregnancy. Then if you see some important points about HCG, HCG is functionally similar to LH, FSH and TSH. It is actually it is anatomically or structurally similar to LH, FSH and TSH, and it is functionally similar to LH only. Okay, if you see HCG detection, HCG is detected on 8th day after fertilization, that is equal to day 22 of cycle, that is equal to 5 to 6 days before mixed period. That is equal to 5 to 6 days before missed period. Okay, now how are you going to detect? It is detected in blood, obviously. It is detected in blood by fluorescent immunoassay, can be done more than radio immunoassay. Okay, this fluorescent immunoassay is actually the most sensitive test which can be done for beta HCG. Okay, if you see the levels, beta HCG will start to increase, and maximum level of beta HCG is seen on 10th week of pregnancy, that is equal to 60 to 80 days, and then it decreases from 10th day to a minimum of 16th week. Minimum is seen at 16 weeks of pregnancy. Maximum at 10th week of pregnancy. What do you see? Maximum means it is the HCG levels will be almost 50,000 to 10 to the power of 5 units per liter. Okay, this will increase every 48 hours in early pregnancy. That is, it nearly doubles. It nearly doubles every 48 hours, and it is maximum in 10th week of pregnancy, where HCG is almost 50,000 to 10 to the power of 5 units per liter, which is seen at 10th week. After that it decreases, and minimum it is seen at 16 weeks of pregnancy. Now, when does HCG level return to normal? So after delivery, it takes around 1 to 2 weeks for HCG levels to return to normal, and if you see after abortion, it takes around 2 to 4 weeks to return to normal. After partial mole evacuation, it takes around 7 weeks to come to normal. After complete mole evacuation, it takes around 9 weeks to come to normal. If you see half-life of HCG, it is around 36 hours. Then what about the half-life of LH? Half-life of LH is about 2 hours. Now, where is HCG increased? HCG levels increase in HCG and decrease in HCG. Increase in HCG is seen in twin pregnancy. It is seen in molar pregnancy, choriocarcinoma. We will see increase in pregnancy. It is seen in Down syndrome. Okay, it is seen in erythroblastosis fetalis. Then if you see decrease in HCG, it is seen in ectopic pregnancy. It is seen in all trisomies except Down syndrome. It is seen in all trisomies except Down syndrome. Then it is seen in abortions. Then what is the function of beta HCG? If you see the functions of beta HCG, it will help. This beta HCG will maintain the corpus luteum of pregnancy. It maintains corpus luteum of pregnancy. It will prevent fetal rejection. Then what is the urine pregnancy test? Urine pregnancy test is a sandwich type of ELISA test. This urine pregnancy test will detect HCG with 20 international units per liter. So what is the critical titer of HCG? Critical titer of HCG value is critical titer of HCG value for visibility of gestational sac. For the gestational sac to be visible, how much HCG should be present? If for transvaginal ultrasonography, it should be more than or equal to 1500 international units, and for transabdominal ultrasonography, it is more than 5000 international units or 6500 international units. So, if you see UPT is positive and HCG is less than 1500 international units, and transvaginal ultrasonography, you are not able to see any gestation sac, then you have done HCG, it is less than 1500 international units. Okay, transvaginal ultrasonography, no gestation sac. It should be at least 1500 international units for gestational sac to be visible. So as a result, if it is less than 1500, then you will have to repeat the beta HCG after 48 hours. And after repeating beta HCG, now if HCG level doubles, then it is early intrauterine pregnancy. Okay, now if the HCG level will increase but does not double, if it increases but does not double, then this is called as ectopic pregnancy. Okay, now if HCG level will decrease, then it is abortion. Okay, then if UPT is positive and HCG is more than 1500 international units, and on transvaginal ultrasonography, gestational sac is not visible. That means if it is more than 1500, then gestational sac has to be visible. But if it is not visible, then it is definitely an ectopic pregnancy. So these are the important points about HCG. Thank you for watching.